and welcome to all members of staff. Could I please have your full attention? My name is Karen Dauber and I am the Director for Infection Prevention and Control at your hospital. On behalf of Mel Pickup and the Trust Board, I would like to welcome you on board for this briefing. We will be flying through some basic infection control messages to promote the health and safety of patients, visitors and of course yourselves. I will now hand you over to the infection control crew. Thank you for your attention.
We would like to remind staff that we are all responsible for the safety of ourselves, colleagues, visitors to the hospital and our patients. Personal items of jewellery and long-sleeved attire should be removed and stored in a locker prior to entering any clinical areas. We ask for a few moments of your attention as we outline further instructions. Please take a moment to read the safety instruction card in front of you. Further detailed information is conveniently located on the Trust intranet and can be found on any Trust computer. Hand gel dispensers are located here, here and here. Remember, during outbreaks of viral gastroenteritis or if your hands are visibly dirty, the alcohol-based hand rub is not effective and you should always wash your hands. For times when hand washing is required, sinks are available in a variety of locations around the ward. Please note the hand washing sink nearest to you, as you will be required to use it during your shift. Prior to providing patient care and at other key times, it is essential that your hands are clean. A reminder of the correct technique is available on all soap and hand rub dispensers. When washing your hands, you should wet your hands before you apply soap. Rub hands palm to palm. Rub the back of each hand with fingers interlaced. Rub palm to palm with fingers interlaced. Rub the back of fingers to opposing palms with fingers interlocked. Rub each thumb clasped in the opposing hand using a rotational movement. Rub the tips of the fingers in the palm of the opposite hand and rub each wrist. Hands should be rinsed under running water, taps turned off with elbows and hands dried thoroughly. In the likely event you are going to come into contact with a patient's blood or body fluids, you must put on personal protective equipment. This is available in a variety of locations around the ward. Aprons are placed over the head like this and tied at the back like this. Gloves are available in a range of sizes and must also be worn. If there is a risk of splashing to the face, you are required to care for a patient with a respiratory infection or perform an aerosol generating procedure. Additional eye and respiratory protective equipment will be required. If an FFP3 respirator is required, it is essential that you have been fit tested prior to use to ensure a secure fit. FFP3 respirators should be placed on the lower part of the face, ensuring the straps are located at the back of the head as shown, moulded to the shape of the nose and pulled down fully under the chin. Once in place, a fit check must be performed to ensure the mask is sealed. A buddy system should be used to ensure the safety of the colleagues you work with. Immediately on completion of the activity you have performed, all items of personal protective clothing should be removed in the correct order, taking care not to contaminate yourself, and disposed of safely in the correct waste receptacle. For your own personal safety, you must always wash your hands after removing all items of personal protective equipment. Removal of personal protective equipment without washing your hands could put you and your patients at risk of infection. Please do not hesitate to ask a member of the infection control crew for advice or assistance. An on-call service is operated out of hours, and if you have any concerns, please let us know. We hope you have enjoyed this safety briefing and we wish you a safe and pleasant shift. Thank you for choosing to work at Warrington and Halton Hospitals NHS Foundation Trust.